Hi, my name is Stephanie Loynd, and I'm here to present my clinical case study. So today, this case study is on a patient, a 32-year-old female. Her name is Elsie. She is about 175 centimeters tall, which comes out to about 5 feet 9 inches. She weighs about 53.6 kilometers. I'm sorry. She weighs about 53.6 kilograms, which comes out to about 118 pounds. Her BMI is 17.4. And so a usual body weight for a female of her height is going to be about 139 pounds. So taking into consideration her low BMI and her low weight, she would be considered to be underweight. So Elsie follows a very healthy lifestyle. She adheres to a vegan diet and she has a personal chef who cooks her meals for her. She also doesn't drink alcohol and she doesn't smoke tobacco. Elsie likes to exercise regularly. If she can, she exercises daily. And she could be considered an adrenaline junkie because some of her favorite hobbies include rock climbing and riding fast on her motorcycle. Elsie has a pretty extensive medical history. She suffers from insomnia. She does not sleep well at night. She also suffers from chronic pain. She's got a vitamin D deficiency. She has type 1 diabetes and Crohn's disease, and she also has a vitamin B12 deficiency. And her lifestyle has also contributed to a lot of injuries. So that includes a pelvic fracture. She's gotten pancreatitis due to a traumatic injury. She also had a rotator cuff tear on her right shoulder that she got from mountain climbing. So Elsie, she does take medications and she's had a previous surgery. She takes Cimzia for her Crohn's disease, and she also takes a vitamin B12 supplement, and that is for her terminal ileal resection surgery. So she did have a terminal ileal resection surgery where they removed about 70 centimeters of her ileum from her small intestine. The terminal ileal resection surgery was due to her Crohn's disease. During the last year, Elsie has been living in the Yucatan Peninsula, so that's in Mexico. Elsie is an archaeologist, and so for her work, her latest mission has been to research and search for the lost cave of Jaguar God, located somewhere around the Mayan ruins of Chichen Itza. In the past 3 months, Elsie has suffered from abdominal distension. She's had poor appetite, nausea, she's had worsening epigastric pain, and new onset vomiting. She lost 16 pounds in the past 3 months. And so she was seen at a remote village for her symptoms, and they diagnosed her with having gastritis. They gave her antacids, but the antacids did not help her symptoms. Instead, her health got worse, and so she decided to be seen at a hospital in the United States. She flew herself to a major medical center in Texas and checked herself in there. Upon admission, Elsie presented with new onset vomiting. She had headaches, a cough. She also suffered from diarrhea. She had a fever. She had night sweats. She had developed a rash on her legs, and she just also had general malaise symptoms. And so the primary diagnosis that she received was hantavirus, valley fever, and small bowel obstruction. So hantavirus is a respiratory infection usually caused by rodent droppings or urine and can be passed through the air. Valley fever is also another infection. and it's a fungal infection, so it's caused by fungus. Her small bowel obstruction was caused by ascariasis, so that is caused by ingesting eggs of roundworms. Elsie's secondary diagnosis ended up being profound protein-calorie malnutrition. Upon admission, her symptoms did get worse, and so she was moved to the intensive care unit, where she developed hypotension and pulmonary edema, and she was placed on a mechanical ventilation system. So x-rays were ordered, and the x-rays revealed a curvilinear soft tissue density cords, and also showed gaseous dilation of the stomach. There were multiple loops of the small bowel and airfield tubular structures that were found in the x-rays. The doctors also did an abdominal ultrasound, which showed the same curvilinear structure. The ultrasound showed that there were very big, massive dilated loops of the small bowel, and they were non-peristaltic. A CT scan was then done, and on the CT scan they found a small mass in the distal jejunum, which showed a obstruction in the small bowel. Elsie was brought in to have an exploratory laparotomy that showed that she had about 100 centimeters of her jejunum to be completely necrotic. A roundworm was also found during the exploratory laparotomy, and also a bezoar mass was found in the duodenum. It had the consistency of noodles. There was also a duodenal perforation that was found. During Elsie's time at the hospital in Texas, she also got a lot of labs done to her, and some of the lab results came back showing that she did have some organ damage. So her alanine aminotransferase levels were increased. They are higher than normal, which can indicate liver damage. It can indicate liver disease and also infection. Aspartate aminotransferase were also high from her lab results, which can be an indication of damage to the liver and the kidneys. Her BUN levels were high, which indicates kidney failure, and her creatinine levels were also high, so that can indicate that she has impaired kidney function. Her alkaline phosphatase was also elevated, and so elevated levels of alkaline phosphatase usually can indicate that there's some sort of bile duct obstruction, maybe bone disorders, and possible liver disease. Elsie also had more lab results. So her white blood cell count was high, which can indicate infection. It can indicate stress, inflammation, trauma, allergies, and it can also indicate other diseases. Her neutrophils absolute was also high, so that shows an increased production in her blood, which can be due to infection. Her red blood cell count was high, and that can be seen in patients with anemia, and that can be due to kidney disease. Her vitamin D 25 hydroxy levels were also too high, which can be caused by oversupplementing, and can lead to liver and kidney problems. Lastly, she had a C-reactive protein lab test that showed that her levels were also too high, which means that she has a lot of inflammation in her body due to infection. Judging from Elsie's symptoms upon admission to the hospital, from her multiple scans, CT scan, ultrasound, x-rays, and from her lab results, I would conclude that she has developed chronic kidney disease, and that is due to her bowel obstruction and malabsorption in her small intestine. Elsie's problem or nutrition diagnosis is a protein calorie malnutrition and nutrient malabsorption evidenced by organ failure, specifically the development of chronic kidney disease, which was due to the bacteria changes in the gut that was caused by the short bowel syndrome and bowel obstruction due to her ileal resection, and then to the bowel obstruction that was due to the roundworms and the bezoar wrasse. The etiology of the problem and the factors that contribute to the nutrition diagnosis, again, are the ileal resection, her diabetes, her history of Crohn's disease, the bowel obstruction due to the roundworms, and her vitamin D deficiency. The signs and symptoms for the nutritional diagnosis are going to be, you see the abdominal distension, the poor appetite, the 16-pound weight loss, nausea. You're going to get epigastric pain, new onset vomiting, hypotension. She got pulmonary edema. She developed hematuria. She developed, or it was revealed that she had chronic kidney disease due to the malabsorption and the bowel obstruction. She had hantavirus, valley fever, and her lab results showed kidney failure and kidney disease. So nutritional goals for people who are suffering from chronic kidney disease are going to be to try to get enough energy to do daily tasks, to prevent infection or more infection, to avoid any muscle mass loss, to gain and maintain a healthy weight, and then specifically to slow the progression of kidney disease. So diet goals for chronic kidney disease is going to be to control the amount of protein, control the amount of sodium, potassium, phosphorus, and calcium that's being consumed, and fluids as well. So protein is important to have in a diet because it helps build and maintain muscle mass, bone mass, skin. It helps maintain and build connective tissue. It helps with organs, and it helps regulate and maintain blood. It also helps the body fight diseases and helps with wound healing. But the problem with too much protein consumption in people with chronic kidney disease is going to be that it's hard to break down into waste products and removed by blood from the kidneys. So that means that eating too much protein is going to put a lot of strain on the kidneys. Next, fats is going to be need to be regulated for the diet for chronic kidney disorder because fat is a great energy provider, but too much fat is going to put people with CKD at a higher risk of stroke or having a heart attack. So the types of fats to avoid are trans fats and saturated fats, and to eat more monounsaturated fats. So that's going to be things like olive oil. The problem with saturated fats and trans fats are that they raise blood cholesterol levels, and they clog blood vessels easily. So fluid retention is another big concern for people with CKD. So lowering the amount of sodium that is consumed is a good way to sort of combat those symptoms of CKD. So it doesn't allow any buildup of fluid in the body. When there's too much fluid in the body, it puts extra strain on on heart and kidneys and raises blood pressure. For people with CKD, it is recommended that no more than 1,500 milligrams of sodium is consumed per day. Potassium and phosphorus intake needs to be controlled because damaged kidneys will allow both potassium and phosphorus to build up in the blood, which will cause heart problems. Phosphorus also will pull calcium from bones, which makes bones more brittle and weak, and too much phosphorus can also make the skin itchy. Lastly, fluid should be regulated so that fluids do not build up and cause edema in the body. Thank you guys for watching my presentation. Last page will be all my citations. Thank you.